Your doctor tells you your blood work is fine, and technically they're telling you the truth, based on the limited tests that were actually ordered. But here's what most people sitting in that waiting room never realize. The standard blood panel routinely misses the very markers that predict the most devastating health crises later in life. Right now, millions of people are walking around with silent conditions building beneath the surface. Not because they haven't seen a doctor, but because the right tests were never requested. Major long-term research has already shown that specific hidden markers in your blood can dramatically increase your risk of diseases like Alzheimer's years before symptoms ever appear. Yet, those tests are almost never included by default. Today, I'm going to give you exactly what most people never hear inside a clinic. The 5 critical blood tests you need to ask for by name, the exact numbers you should be looking for, and precisely what to say if your doctor hesitates. I'm Dr. Daniel Carter, and this channel exists for one reason: to give you clear, evidence-based health information that often gets rushed or skipped entirely during appointments. If you're new here, subscribe now, because one video like this can genuinely change the trajectory of your health. Now, let's get into it, because the first test on this list could be the difference between catching a problem early or facing it when it's already done serious damage. The first test is hemoglobin A1C. Most people have had a fasting glucose test at some point, a single snapshot of your blood sugar, usually taken in the morning. The problem? Your blood sugar doesn't stay the same. It fluctuates constantly throughout the day. That means a single reading can look completely normal, even while damage has been quietly building for years. A1C works very differently. It measures your average blood sugar over the past 3 months by analyzing how much glucose has attached to your red blood cells. Think of it like this. A single glucose test is a photograph. A1C is a full 3-month documentary. One shows a moment, the other shows the truth. And this is where it becomes urgent. If your A1C falls between 5.7% and 6.4%, you are already in the pre-diabetes range, and that stage silently accelerates damage throughout your body. Your kidneys begin to suffer. The tiny blood vessels in your eyes start to weaken, and research has shown that cognitive decline in older adults can progress nearly twice as fast at this stage compared to normal aging. You want your A1C below 5.7%. If your doctor only orders a standard glucose test, you need to specifically ask for hemoglobin A1C, because these are not the same test, and one is far more revealing than the other. The second test is 25-hydroxyvitamin D, and this is one of the most misunderstood markers in all of medicine. Despite being called a vitamin, vitamin D actually behaves like a hormone in your body, influencing over 200 critical processes, including your immune system, bone strength, brain function, and cardiovascular health. The problem is, deficiency is incredibly common, especially as you age. Your skin becomes less efficient at producing vitamin D from sunlight, and most people spend far more time indoors than they realize. Here's where it gets serious. Low vitamin D levels have been linked to increased fracture risk, higher rates of heart disease, and faster cognitive decline. But the most important detail, most labs label anything above 20 non-mel as normal. However, for optimal health, especially in older adults, experts recommend levels between 40 and 60 on JML. That gap between normal and optimal is where many people continue to feel fatigued, achy, and mentally foggy without ever getting real answers. This is one of the most correctable issues I see, but only if it's actually tested. The third test is high-sensitivity C-reactive protein, hsCRP, a direct measure of inflammation inside your body. And if there's one underlying driver behind heart disease, Alzheimer's, and even certain cancers, it's chronic inflammation. The dangerous part is that it doesn't cause obvious symptoms early on. It burns quietly, damaging tissues for years before anything is diagnosed. This test can detect that process early. What makes this even more critical is that elevated hsCRP has been shown to predict heart attacks even more strongly than cholesterol levels. Yet it's rarely included in routine testing. You want your hsCRP below 1.0 mmol. Between 1.0 and 3.0 indicates moderate risk. Above 3.0 signals high risk and demands immediate attention. And make sure you request the high-sensitivity version, because a standard CRP test often misses the subtle elevations that actually matter. The fourth test is TSH, thyroid-stimulating hormone. Your thyroid is essentially your body's control center for metabolism, energy, mood, and even heart rhythm. The issue is that thyroid dysfunction is extremely common in older adults, yet it's often overlooked because the symptoms look like normal aging. Fatigue, weight gain, brain fog, depression, cold sensitivity. These are frequently dismissed instead of properly investigated. Here's the critical detail. Many labs consider TSH levels up to 4.5 as normal. But for optimal function, especially in older adults, many experts recommend a range between 0.4 and 2.5. So yes, you can be told your results are normal, while still feeling consistently exhausted and mentally off. That difference matters more than most people realize. And finally, the fifth test, the one that may be the most important of all, is homocysteine. This is an amino acid that builds up in your blood when your body lacks key B vitamins like B6, B12, and folate. When levels rise, it becomes directly toxic to your blood vessels and your brain. Elevated homocysteine has been strongly linked to a significantly higher risk of Alzheimer's disease, in some cases nearly doubling that risk. But here's the powerful part. This is a modifiable risk factor. You can actually bring it down. Research has shown that targeted B vitamin supplementation can slow brain shrinkage in people with cognitive decline, in some cases by as much as 30% or more. That is not a small effect. You want your homocysteine below 10 umol/L. Between 10 and 15 is elevated. Above 15 requires immediate attention. So here's exactly what you need to do before your next appointment. Write these 5 tests down and bring them with you. Hemoglobin, A1C, 25-hydroxyvitamin D, hsCRP, TSH, and homocysteine. Ask your doctor directly to include them in your next blood work. If insurance becomes an issue, many of these tests are relatively affordable out of pocket, and the value they provide is far greater than the cost. If your vitamin D comes back low, discuss proper supplementation. If your homocysteine is elevated, ask specifically about the right forms of B vitamins, because absorption matters, especially as you age. And always review any supplementation with your doctor, particularly if you're on other medications. Your body gives you signals long before a crisis ever appears. These tests are how you learn to read those signals early, when you still have time to act. You don't have to wait for a heart attack to discover inflammation has been building for years. You don't have to accept cognitive decline as inevitable when certain risk factors can be corrected. The knowledge exists. The tools exist. The only question is whether you ask for them. If you're serious about your health, take action right now. Comment "Getting tested" if you're going to request these at your next appointment, or share which ones you've already had done. because your experience could help someone else realize what they need to check. And if you found this valuable, make sure you subscribe, because in the next video, I'll be breaking down 7 commonly prescribed medications that new research is linking to accelerated memory loss in adults over 60. I'm Dr. Daniel Carter, and remember, no one will ever advocate for your health more than you.